Okay, good afternoon. This afternoon, as I have promised, we're going to discuss transcutaneous electrical nerve stimulation. Now, I hope while you are attending to your CISO days, you'll also try to access this from time to time, especially during the evening. Okay, so that you'll not be left behind in our coverage in our uh, lecture in physical agents. So we're going to talk about TENS. Okay, so from the the TENS is an abbreviation of transcutaneous electrical nerve stimulation. So as we all know, in the abbreviation, transcutaneous means it's on the surface of the skin. Electrical nerve, so it refers to stimulation of the nerve using electricity. So the primary aim of this modality that we that this modality tends is to treat or to provide a degree of relief of the symptoms, basically the pain symptoms, by exciting your sensory nerve. Of course, we perceive, we receive stimulus coming from this nerve, then it is being perceived, perceived rather by the by the central nervous system. So it has two ways of relieving pain. First, it's either using pain gate mechanism or using the pain gate theory or the opioid system. Okay, so then the effectiveness of TENS varies with the clinical pain being treated. So depending on the type of pain, if it is neuropathic, if it is uh, somatic, or it is psychosomatic, or neurogenic, or it could be caused by vasculogenic. When you say vasculogenic, it is in vascular in origin. So depending on the type of pain. Uh, so the research shows that it provides a greater pain relief than the placebo intervention. So using placebo drugs, whatever, using TENS, of course, since the patient has feel something, so therefore it could provide a placebo more than the placebo effect because the patient could feel something. Unlike in placebo, that well, it is a placebo drug, so therefore there's no content in it. It is just a psychosomatic effect. I mean, ang na-receive sa patient, kung na-relieve kunuhay siya. So in the clinical context, commonly it is assumed that the TENS provide symptomatic pain relief using the electrical stimulation. Okay, so that's the clinical uh, context of TENS. So when you say, I'm going to use this, I'm going to apply this, automatically we assume that that is for pain relief, which is true. No? So TENS is most commonly delivered from small and held battery powered devices, which we can purchase it over the counter. So actually, in some, especially here in the Philippines, we could easily access or buy it in even in Lazada, even in Shopee. There are a lot of dealers, no, that deals pens. No? But in some other countries, if you are not a an authorized or a licensed individual to use this modality, it is not for sale. Let's take for example in the US, you cannot easily buy these modalities if you are not a licensed practitioner. No? Tapos, ano siya, clause dito, no, sa product kuan niya nga dapat ang makapalit ani is ana ra authorized ra gyud. So, but of course, diri sa ato lahi man ta, no. So these are example of tens unit. So ana kan siya, no. So these are portable unit. Uh, some of which are not portable, but they could easily be placed or mounted in certain uh, certain uh, platform so that you can easily move it in the rehab, no? So it is interesting that in therapy practice, the majority of practitioners consider TENS as a treatment options in circumstances when a patient is experiencing chronic pain. Uh, so in treating chronic pain, of course, it is already on and off. So it is expected that when you use TENS, it might have a not have a significant effect uh, on the symptoms that is presented. However, they found out that even in chronic form, it is still effective, even in acute. No, there is an evidence the effectiveness of this modality in relieving acute pain conditions. So depending on the type or mode that is used. No? So TENS is a treatment technique that uses non-invasive and have a few side effects. Since you're just going to place a probe or an electrode to the area where the pain sensation is felt, then you are just going to put on the modality. So therefore, you are not taking any internal medications. So it has a fewer side effects. Maybe some of the side effects is maybe allergic reaction to the skin secondary to because of your allergy with the adhesive or with the medium or coupling medium that is used. So those are the basic no side effects we can easily see sa patient or even reaction tingali sa skin nimo because of the tape na gigamit para mapilit siya o di ma-move ang electrodes or sometimes maybe reaction to the velcro no sa velcro nga gigamit so inana so most of the TENS applications now are using pre-adhesive or self-adhesive pre-gelled electrodes which has several advantages because if it is a self-adhesive it must be a single use so if it is a pre-gelled electrodes again it is a single use so here there's a lot of advantages because it reduces the risk of cross contaminations. It's very easy to apply. Of course, lower allergic incidence, and of course, it has a lower overall cost. Because there in the other countries, the electrodes are just free. No, so they just pick it up in their department, then they are going to use it for their patients. But of course, here in the Philippines, it might not be that manner, no? Medyo mahal man gid diri, no? Bisalag tag 100 ra na pero mahal-mahal man gid na siya, no? Medyo costly man siya sa ato. So there are also other electrode that uses garment-based electrodes, you know. So these are example of these are this one. It is being worn out sa hands, no? So this is an example of gloves, garment-based electrodes. So usually sa mga naiham pain, neurogenic pain or uh, neuropathic pain. So sa mga Actually, carpal tunnel syndrome. So, kana ginagamit na siya, no? Patalo siya ni matras kamot or sometimes in patient with arthritic, no, fingers. So, i-wear lang na niya. So, that's a very good, no? Sayon ra siya kaayo, no? It can be applied in all over the hands, no? In digits, without any problem with kan kay base na yung mga exposure sa uneven or bony prominences, but wala na siya kung ma-eliminate siya. So usually it is a single use. At the same time, the machines now are more digital, no, with available extra features. Dili na siya um, parehaan eh. Let's take for example this one. This is still an analog one. It's an analog. This one, this is an analog. So the machine depends on the efficiency of the machine depends on the expertise of the one who operate the machine, no, the equipment. Here, this is already a digital one with a pre-program or pre-select parameters, no. Ano siya yung ginatawag nga automated settings or pre-programmed settings. All you have to do is to press that pre-programmed settings, then the machine will just operate on its own automatically. Then it will even turn off, no, after its use. So we have here the machine parameters. So what are the parameters intense? So we have here the current intensity. Okay, that refers to the strength. Well, typically ranges from 0 to 80 milliamperes. It is just a very small amount. No, it is enough to give or to provide physiological effects. So since the target is primarily the sensory nerve, and as we all know, sensory nerve is um, very sensitive to any type of sensation. Okay, so the machine will deliver a discrete pulses of electrical energy in the rate of delivery of these pulses. Gitawag na siya nga pulse rate or frequency. It is in the term of pulse per second. Okay, so 1 to 2 pulse per second. So 1 PPS equivalent to 1 hertz. So when you say 1 to 2 pulse per second, that is 2 hertz. No? Up to 200 and 250. So here, we natay 200 to 250 hertz. No, that is considered. So if you as tense. So if you notice, the frequency is too low. Okay, so of course you have also tense which is high in frequency, na low frequency. So depending na siya kung asa na siya gamito nato. No? Because there are some pain would response to low frequency type of electrical nerve stimulation, na po iban nga mo respond lang siya sa high frequency, no, so depende kung nasa na to siya gamiton nga types of pain. Okay, so we have also duration. So duration refers to the duration of each pulse, may be varied from 40 to 100 to 250 microseconds. Recently, evidence would suggest that this is possibly less important control, that the intensity or the frequency most effective setting in the clinical environment is probably around through to 100 microseconds. So dili kay ni siya importante ang pulse duration. So kung unsa siya ka dugay ang pag-stimulate sa nerve, no? Or sa motor point. So motor point. Sa nerve rather, not motor point. Okay, we're talking about tense man. So inana. So in addition, the most modern machine have other parameters such as burst mode, in which the pulses will be allowed or out in the burst or trains, usually at a rate of 2 to 3 bursts per second. So, nasa burst, na-cycle it na pag-increase, no? Uh, so, mga 2 to 3 pulses ang iyang gina-fire each time, no? Nga mag-send out siya og electrical signals. So, then we have also the modulation mode. A modulation mode or E, uh, available, which employs method of making the pulses output less regular and therefore minimizing the accommodation effects which are often encountered with this type of stimulation. So here we have modulation mode. When you say modulation mode, it is uh, naa siya ay variation, no, na mag-fire sa burst, mag-fire na po siya og hinay, then another burst. So this type of current is designed um, to minimize adaptation of the nerve. No? So, nana siya. So, the pulses delivered by TENS stimulators vary minimally. No? So, in all TENS unit, gamay ra gyud diferensya sa ilahang mga kwan. No? So, mostly they are constant, high frequency, low frequency, there are mode, there are burst. No? So, depende. So, usually sa burst, you're just going to increase the number of the frequency in one stimulus. uh, in mode, you are just going to control to varies the firing rate of the firing rate as well as the pulse width of the stimulus, no? So, inana. So, mechanism of action. So, usually when you use TENS, it aims to excite the sensory nerve, basically the A beta nerve fiber, which is a fast conducting sensory neuron. No? Diba? You have your A alpha, A beta, then you have your A delta, then you have your C, diba? Nga mga fiber. So, kana siyang A is large, diba? Ang B medium size, ang C is gagmay, then open pa siya, wala siya may legit, no? So, uh, it excites sensory nerves, and so by doing, it activates specific natural pain relief mechanism using your pain gate mechanism and endogenous opioid system, wherein your secretes the tissue that it stimulates secretes now opioids, no, yung mga substances sa body which blocks the pain sensation, no. So here, in pain relief by means of pain gate, it involves excitation of a beta sensory fiber. So here, since fast conducting man siya compared sa C fibers, which is slow conductor sensory nerve fiber, so maunhan niya dito sa may gate, dito sa imuhang facialis cuneatus and gracilis, no? Dito sa imuhang spinal cord. So usually, nata ginagawa dorsal lemniscal system, which usually transport your pain sensation to the brain. So maunhan niya na dito sa imuhang gracilis, fasciculus gracilis, ang kanang pain sensation kay fast conducting man ni, no? Fast man siya. Iyan ang i-block dito ang gate. So blocking the gate or closing the gate of the C fiber. So what will happen? The nerve or the sensory signal will not pass through. So therefore, it is not perceived by the upper motor neuron, no? So, or by your higher center ang pain sensation. Tama na siya sa spinal cord. Okay. So, but however, there's other version of what we call pain gate mechanism is that since when the sensory signal coming from your TENS reaches the gate first, so it will go up first, no, to the upper center or highest center dito sa imuhang area 1 to 3, which is your somatosensory area. Saka na siya una dito, so it will be preserved at the same time because of it is a high intensity, no? High intensity siya, so therefore when the pain sensation, which is just a low intensity type of pain, especially if it is chronic, so mahitabo dili kayo siya nimo ma-perceive kay ngano gamay ra man yung intensity. Ang kaning imong uh, tense is kusog man, so mas mauna siya nimo or mas ma-perceive to nimo ang perceive to nimo ang stimulus coming from the tense unit. Okay, but this is just temporary. uh, no, it is just temporary that when you remove now or when you stop treating the if you use this mechanism, if you're going to remove now your modality, umana ka sa 20 minutes or 30 minutes, pagtanggalin mo, of course, since there's no sensation now coming from the tense, and what remains is the sensation coming from the pain or the area where na ay pain. So, of course, katong pain yun, di mo ma-perceive. No? Kaya wala naman tong ang tense. No? That's why in mga bagong panganak, ang tense ana nga ginabutang sa ilahang lumbar area is usually 24 hours, no? Sa mga bagong panganak. So inana na siya, nagka-continuous na siya dito nga to provide pain relief. Okay. So but the alternative approach is to stimulate the A delta. Okay na, A beta man to. The A delta, which responds to preferentially to low frequency stimulation, usually around 2 to 5 hertz or 2 to 5 pulse per second ra ang gina-fire. So kung imong kwan siya maimog gyud siya ma-perceive nga mag-ana magpitik-pitik, no? Kay 2 to 5 man per second, so imo siya ma-feel gyud ang murag na ay pulsating electrical signals coming from your machine. Then what happens is it stimulates your um, katong mga adjacent tissues dito, no? So or the junction itself, the neuromuscular junction, to secretes what we call endogenous opiate, such as enkephalin, no? In the spinal cord. So kani siya nga mga klase sa mga kani siya nga mga klase sa such as endorphin, mga ana. These are natural pain relieving substance. So nga gina-produce atong body. So dito siya sa cord mo release siya ana. So pag ma-release siya ana, of course instead of perceiving pain sensation, you cannot perceive it because there is now a local, just like a local like anesthetic that is injected in the spinal cord area. Murag na kay spinal block na gihimo. We call that localized. Okay, dito naman siya sa cord, no? Specific ra siya dito nga level because of the presence of this endogenous opiate, the cord, no? So which reduces the activation of the noxious sensory pathways going up into sa brain, no? So dili na siya ma-activate, so dili kaagi ang pain sensation coming from the injured or from the area that is affected, no? Okay. A third possibility is to stimulate both nerve types at the same time by employing burst mode. So here, kung higher gani siya o higher frequency ang imong gigamit, The usual activation is your pin gate mechanism. But if you're going to use the low frequency stimulation using TENS, the the one activated is your uh, opiates mechanism, which nara po siya sa spinal cord level. And a third possibility is when you use burst mode. In burst mode, it is both na siya ay dito sa blake na gamit siya o pin gate mechanism, and it uses also the opiate mechanism. So because in burst class, it alternately, the machine fires alternately, no? Na siya firing a low frequency at the same time na po siya firing a high frequency. So puli-puli na, they are in alternate mode. So there's no time for your um, skin, muscles, and nerve to adapt. Okay. So by far, the burst mode is the most effective approach to pain relief through sensation because ang imong pain gate is temporary ra. It is only there when the modalities is there. But when it is removed, pain sensation back. Ang imong opiate is a prolonged, no? Sometimes it would take hours because it would take hours to remove this opiate substance in the cord, no? Kay kuha mo na siya na may enzymes na mo kuha nila pod para mo return sila. So it would take time. So medyo long lasting siya. Sometimes it lasts for 30 minutes, 1 hour, 2 hours, 3 hours, or 4 hours. So inana siya. Okay, so on burst mode, it utilizes the two. So since it utilizes the two, so of course the effectiveness is much better compared to the high and low frequency because it stimulates the two mechanism. Okay, so traditional TENS or high TENS and normal TENS. In high frequency TENS, it's around 80 to 130 hertz or pulse per second and employ a relatively narrow, short duration pulses through I mentioned above. There is less support for manipulation of the pulse in the current research literature. So the stimulation is delivered at a normal intensity. So ang normal TENS, no? So usually ang duration niya, ang iyang sensation nga ma-feel sa patient, it is strong, kusog pero comfortable. Mao gina siya, no? And it is applied for 30 minutes. That is the minimal effective time. Okay. So again, since it is traditional, mano siya pareha siya sa high. Kung wala nang machine, wala na po siya effect, no? So, mano siya, no? So this is the A-beta pain gate activation 90 to 130 hertz. Appears to be more effective with acute pains and most effective during the stimulation period, limited carryover period. So can use for as long as needed, not time limited. So dili na siya time limited ang imuhang traditional or high frequency stimulation nga TENS. Okay? Mm, unlike sa imong burst of low frequency nga 20 to 30 minutes lang. Okay, then you have your acupuncture TENS. Okay, so this is a low TENS. It is used for acute TENS also. Use lower frequency stimulation from 2 to 5 with wide longer pulses. The intensity employed will usually need to be greater with the traditional TENS. So, kani siya, pulse lang siya, pero once nga puncture man siya, taas siya intensity, pero fuan, no? Low frequency siya. No? Kusog siya kaayo, pero pag beat niya up, pang, then down, wala na. Then, down, kusog, pero 2 to 5 pulses per second raman. So makita nimo nga ma-feel niya nga murag na ay ah sani murag na ay nagpitik-pitik na ma-feel na niya. So ang difference sa sensation sa high ug sa low is this. In high, ma-feel nimo nga na current nga nagdagan sa imong skin, ma-feel nimo pero di nimo ma-feel ang pulses. In low, ma-feel nimo ang pulses yun murag nag-beat siya. Kung paano murag nga gana. Ang sa high frequency, so ana paspas. So inana. So the intensity employed will usually need to be greater than that of the traditional TENS. It is still not at the patient threshold, but quite a definite strong sensation. Something like 30 minutes will need to be delivered as minimally effective dose. So, muna minimal effective dose din niya, 30 minutes. So, it takes some time for the opioids. Nganong inana man kay it takes some time for the opioids to build up with this type of TENS, and hence, the onset of pain relief may be slower with the traditional mode. So, inana siya. So, sa low frequency, since nga ang target niya is opioid mechanism, niyan, ang opioid mechanism only, it would take time to build up these opiates in your spinal cord area. So, of course, the pain relief will also take time. So, that's why medyo taas-taas. Ang application anemia sa low frequency, it's about minimal is 30, no? 30 to 45 pwede. Ana siya. So, but of course, ang iyang pong effect is a little bit longer, no? Kaya na may carry over niya, no? From minutes to several hours, no? Although it may vary from different patients. So, ang imuhang appears to be more effective in chronic pains, effective during stimulation period, but has a significant carryover. So, effective niya siya sa mga chronic, no? Sa chronic type of pain. Then you have brief intense tense. This tense mode that can be employed to achieve rapid pain relief, but some patients may find the strength of the stimulation too intense. So it will not tolerate it for sufficient duration to make the treatment worthwhile. The pulse frequency applied is high, about 80 to 130. So, brief intense tense. So, bumao rin sila sa high frequency, pero naara siya ay pulses, no? So, the current delivered at the close to the tolerance level for the such that they would not want the machine to turn up and any higher. So, inana lang. So, taas ni siya og intensity, no? So, ang example ana niya is, let me see if there is a sample of frequency. Okay, so here this is an example of kana, could be a brief, pwede na siya brief ang B. So inana siya, so ang burst, a brief intense tense means kadyo ra gyud na siya, 15 to 30 minutes at least is most that would normally be used. So taas siya, no? Intense kaayo, no? Taas iyang intensity, pero kadyot lang after that one. This is for immediate pain relief. So usually it is very effective in acute, no? So siyempre in acute, taas man kayo ang sensation niya sa pain or intensity pud sa pain niya, from 0 to 10, so probably naagid siya sa 10. So kay taas man din imo siyang tagaan pud, applyan nimo siya TENS which has a higher intensity compared to the pain sensation. But of course in a very brief lang. So, taman dito sa ihang threshold yun, no? Untop sa threshold niya sa TENS, no? Pag if you're asked the patient na, is it okay ma'am? Yes. Can we increase it? May na lang siya no, enough na na. So that is already on the threshold level. No? Then you have your burst mode TENS. As described above, the machine is set to deliver traditional tense, but the burst mode is switched in, therefore interrupting ni siya, no? Ang brief tense is continuous ni siya. Rapid man, brief mo, intense tense. So, kani siya yung sa burst mode, this is interrupting. Mano siya yung nakanindot sa burst mode, ganong it could stimulate the opioid mechanism and the pain gate mechanism because it is interrupting, no? Na say pulse. Di ba sa atong mga discussion, ang effects of pulse is both ni siya tissue and uh, kung sa mga heating modalities sa physiologic effect and thermal effect, no? So mo gyapon ni siya sa electrotherapy, no? When it comes to addressing pain, ang pulse gyapon mao gyapon dual ang iyang maigo, no? Opioid and gate mechanism. So because of the interrupting characteristic niya, taas tuod siya pero undang-undang man. So therefore, interrupting the stimulation outflow at rate of 2 to 3 bursts per second. The stimulation intensity will need to be relatively high, though not as high as the brief intense tense. So, more likely the low tense, it is proposed that the application of burst mode tense can effectively stimulate both pain gate and opioid mechanism simultaneously. So, muna siya yung advantage yan eh. In modulation mode, the machine delivers less regular pattern tense, stimulating an attempt to minimize the accumulation effect of regular pattern stimulation. So, mo na siya ang purpose niya sa modulation mode. Taas to check intensity pero interrupting siya kay para to avoid accumulations. Ang difference nila, maybe you will ask, what is the difference between burst and the modulation? So burst, ang ihang frequency, although it is kusog tuod siya, pero same constant lang ang intensity, no? Walay increase. So all throughout, no, ang pag-stimulate niya, walay variation, no? Flat lang siya, pero kasi kalit lang. Kalit din mo down pud siya, kalit then balik na sad, no? Then taas ang duration, then mo down, then kalit. Then sa mode lahi, no? Mo fire siya tag 2 to 3, then down, then balik na pod 3 down. So ang ihang duration is a little bit shorter compared sa imuhang burst mode. Ang burst mode dugay ang duration kaysa imuhang modulation mode. Okay, so inana siya ang kalahian nila. So frequency selection with all the above mode guides, it is probably inappropriate to identify. So since ano siya mga mode diri, so dili na siya kinalani ang frequency nga naman selection nimo because this is already pre-selected, pre-programmed na ni siya. So pag set nimo siya modality inana, automatic na, you don't have to be worry now about the frequency, about the parameters, the width, the peak, the on and off time, dili na kay ngano man siya na may mag-set, no, kay pre-programmed naman na sila. Unless diri ka sa traditional sa low and high, no, diri high and low tense or normal tense, no, kay kana siya that is analog, no. So but of course ang imong effect na is parehara sa imong low and high intensity, traditional. Okay, so then we have the stimulation intensity. So here, ang intensity po, based na siya sa comfort sa patient. Strong but comfortable. Mao na siya dapat ang basihanan nato. Okay, so dira siya magbase. So always kanya Ask you the patient, ma'am, is it okay? Is the sensation okay? Can we add? Can we decrease? Or ana? Mas man, tumbuhinan, dugangan ang intensity or dili. So, always ask your patient. So, kung di na halos siya ka-feel, di mo na po siyang increasean. Pero kung panginaw niya, ay sakit yun, di si decreasean. O, so, ano ra? So, ang basihanan yun na to sa stimulation intensity based on the patient's feeling. So, sugtod siya pero comfortable, then go. So, electrode placement. Electrodes, in order to achieve maximal benefit from the modality, placing the electrodes plays a very important role. So you can place your electrodes either on the side of the lesion or directly on the pain areas above it. So of course, kung sirado, pwede dito sa taas. Pero kung open siya, maybe sa kilid lang, di ba? The most common mechanism employed to achieve this, there are many alternatives. No? So these are the alternatives. Uh, so most of which are based on the appropriate nerve root. Diba? So stimulation on the appropriate nerve root. So kung asa man dapit siya nga area gyud. Oh, so when you say the injury is on the L5, no? Na adra dapit, let's take for example, asa man ang L5. Anterior parts sa lower leg, dira ang ihang pain. So dira natin siya sa dira nga area gyud i-apply, no? Di ba? So, let's take for example, ang ihang problema is nasa nerve pain. Na radiating diba sa anterior leg. So, ka L5 man na asa mo kung mag-stimulate nila dito sa root or diri sa tail. So, you could place it dito sa L5 level, dito sa back niya directly, or pwede rin pwede diri sa distal part. No? Then, stimulate the peripheral nerve best if proximal to the pain area. So, kung naglitan ang iyahang pain sensation niya is sciatica, no? Gikan dira sa lubot paubos dito. Man ka mo stimulate nga taas man kay coverage sa sciatica, gikan siya diri sa lapalapa. O gikan siya sa lubot paingon sa lapalapa, where you will put your electrodes. Of course, you will place it to the most proximal part, which is in the buttocks area or in the low back area. No, but basically, if the origin is piriformis syndrome, then you must place it above. No? So, dira sa taas gamay sa lubot, no? Stimulate motor point innervated by the same root level. Stimulate trigger points or acupuncture points kung asa dapitong pain yun niya. Dito ibutang. Stimulate the appropriate dermatome or myotome or sclerotome. So, kung dapit ang myotome, dermatomes, dito siya ibutang, no? So, pwede na siya. So, kay myotomal man na, let's take for example, maingon siya nga na siya ay problema sa neck, no? Sakit diri sa shoulder. So, kung sakit ang shoulder, asa may malapit? Ano, problema siya sa L3. L3. C3, C4, dapit nga level sa cervical vertebra. May sakit. So, using my dermatomes, asa man na nimo dapit i-apply? Dapat diri dapit sa deltoid, no? Dara. Deltoid ang problema. So, ina na siya. So, apply nimo na imong dermatome and myotome. So, dito dapit siya ang pain, man siya nerve root level, level 1, no? C5, C5 ang problema. Sa asa man dapit ang C5, biceps. So, you can stimulate the biceps. Myotome, that is the myotome. If pain source is vague or diffuse, particularly extensive, one can employ both channels simultaneously. Kung dako gid siya, no, katag ang pain, di ka kabalo. Mayon siya gahalang man akong likod sir, asa man dapit, may tudlo niya diri hang tibuok nga low back, gahalang. Okay, to provide pain relief. Okay, so you can employ using two channels, the 4 electrodes gamito nimo. Kay lapad man kayong area. So ina na. So it can be managed of a local or referred pain combinations. One channel is used for each component. The low frequency acupuncture light TENS can be effectively applied to the contralateral side of the body. So mula ni siya yung problema kay because if diffuse siya ang pain, yeah, you will use labi na kung digital na siya kay since pre-program naman siya, so whatever program you are going to place the one channel, that the same program will be applied on the other channel. So ano siya problema sa digital kay di mo siya manually adjust. Unlike sa traditional, pwede nimo siya mo-increasean ang frequency sa PCAS nga channel. Niya ang PCAS channel i-low na ko, no? So you can use combination. But of course, in new karon nga mga unit, yung mga TENS unit, na pre-program na pud siya. At sometimes na siya ay alternate, no? Na siya ay mawakalit lang siya low ang frequency or ang ang frequency din mo taas ang pikas or sometimes mas swap siya no nga mo taas ang pikas niya mo low na po ang pikas, so ana siya, so depende sa klase sa unit, no, sa kanang mga digital nga kwan. So ang mga bag-o karon nga naa na sila yung mga variation, no, nga dili na kinahanglan nga mag manual adjustment ka just to use the low and high sa duha ka channel kay automatic the two channel will fire, uh, will adjust on its own. Ang isa mo high, ang isa mo low, ang isa mo high na po din, isa the other one will low. So inana siya. So here we have now the contraindications and indications. So here, these are the contraindications for the TENS. So basically, if your patients have problem with mental health, it is not applicable because how can you rely with its response? Pangutan-on nimo siya, sakit o dili ming katawa pa siya, sakit. So asa may tuhan? Or would you believe? Nagkatawa siya, yan ingon siya sakit, or nagkatawa siya kay murag wala siya gisakitan o katong iyang istorya nga sakit. Oh, so asa man, no? So lisod na siya kaayo na mga problema sa pangunahuna, di na able to cooperate, dulo na dementic na ang patient or dementia, no? Alzheimer's disease. So lisod na unreliable na mga answer ani, no? So dapat conscious siya, no? Has been widely studied over the trunk, abdomen. So here, electrodes over the trunk, abdomen, or pelvis during pregnancy is contraindicated. So dili siya pwede gamitin sa buros, no? Labi na kung ang applyan nimo is the body, no? Kaning diri sa abdominal area, no? O sa back, dili siya pwede, no? Um, TENS during labor for pain relief is both safe for mga anak siya pwede nang gamiton, patient with pacemaker dili pwede gamitan, patients who have an allergic response to electrodes, gel or tape, electrode placement over dermatological lesions, so di siya pwede gamiton sa mga na-skin lesions because makatabang tingali siya pa-spread. Okay, siyempre ang bakterya maadto dito sa imong probe din ibutan na po di mo spikas na application over anterior aspect of the neck or carotid sinus. So, di siya pwede dapit diri sa carotid area. No? Because what is in the carotid area? You will have the carotid sinus, di ba? Ang sinus is controls blood pressure. So, it might affect your blood pressure dito nga gasaka pa yan sa brain, no? Precautions. If there is abnormal skin sensation, the electrode should be preferably positioned elsewhere to ensure effective stimulation. So kung naa kay uncomfortable sensation nga na-feel nimo sa electrodes, automatic i-remove nimo na siya, i-off ang machine, i-remove, then you could transfer it to another area na duol-duol ato nga naay muscle gyud, no? Mas maayo. Electrode should not be placed over the eyes. Patients who have epilepsy should be treated at discretion of the therapist, consultant. So, kung na-epilepsy, pwede ka matreat, pero depende na sa imo, no? So, use your clinical decision making. Are you going to use it or not? And let's take for example, wala man siya attack sa seizure. say attack sa epilepsy, ano, di nimo siya gamitan. So, pwede nimo siya gamitan. No? Avoid active epiphyseal regions for children. So, di siya pwede gamitan sa proximal and distal parts sa joints. Kay, now, it could affect the growth of the bone. The use of abdominal electrodes during labor may interfere with fatal monitoring equipment. It is therefore best avoided. So, during labor, although diri na pwede siya gamitin sa pagpanganak, so di siya pero pwede siya pwede ibutang sa abdomen. Asa man siya ibutang? You will place it in the lumbar area or in the pelvic area. No? So di siya pwede sa lumbar, sa abdomen. Kay it would interfere with the ultrasound. It might, no? Ginagamit ka ng monitoring niya sa ultrasound na, yan butang sa tiyan, magpanganak, no? Para madunggan ang heartbeat. So, di siya butang sa abdominal area ang imuhang tense. Di siya butang dito sa lukod. Okay? So, inana ang precautions. Okay, so that's all, folks. May God bless you with your activity, and uh, please uh, try to check your module in other subject also, because your teacher might be uploading also lecture during this period. So, of course, you will just access it during the evening, not during the day, wherein you have games online. Okay, thank you for listening. So these are the resources. Okay, these are the resources. So actually, you can see this in the internet, no? It was kang kuan man siya kang Tim Watson, no? Na siya sa internet, just search for it, electrotherapy by Tim Watson, na siya page gyud dito. Okay, so thank you for listening, and good God bless and good day.